some varus stress tests. So the valgus stress test goes towards which ligament? Medial collateral. So we're going to go one hand proximal to the knee, one hand distal to the knee. We're going to do a little push-pull. We try and open the medial side of the knee. Any pain?
A little bit.
A little bit. Where is it? Can we do it again?
I don't know. Yeah. Just feels a little sharp.
Sharp. That's not good. Okay. But hard to isolate?
Yes.
Okay. So again, with patellofemoral pain syndrome, sometimes the pain is on the medial side of the knee. So maybe that's a positive valgus stress test, maybe not, right? We could let's palpate that medial collateral ligament just to see if there's any local pain. So under there?
Oh yeah. Yes.
Sharp?
Yes. Feels a little tingly.
Tingly. Okay.
Yeah.
Okay. Let's compare it to the other side. Same, different?
It was more intense on the left side. I can still feel it.
Okay. All right. So maybe you have a mild positive for positive result for medial collateral ligament issue on the left. Doesn't seem like it's bad, but maybe a little bit, right? Varus stress test. We're just gonna reverse our hands. Anything there? Okay. So LCL is good. Anterior, posterior drawer. Again, we're going to kind of sit a little bit on the edge of the foot. If you want, you can put your thumbs kind of across the joint line and notice how much the tibia moves relative to the femur. Again, the biggest thing that I'm focusing on is there excessive movement, and probably more specifically, is there pain with that movement? And I think we got, still getting a little clunk in there. Any pain?
Not really, no.
Okay. So we got some laxity in that ACL, but not to the point where it's causing pain. So would I say she has an ACL issue? I'd say you have laxity in your ACL compared to the other side. Whether or not there's any micro tearing, don't know. Maybe it just got overstretched. Right? Oh, and the posterior drawer test. Not likely to recreate anything. Anything with that? Okay.
What is that testing again?
The posterior drawer?
Yeah.
PCL.
Okay.
Which doesn't usually get injured. Okay. Questions on any of that before we dive into some new stuff? All right. So we're holding into our back of our minds maybe a little bit of MCL stuff going on. Let's look at some muscle tests. Okay, so I'm gonna have you scoot so that your knees are right at the edge of the table to test the quads. The quads do what?
Extend.
Extension of the knee. So what am I going to do? I'm going to put her slightly in the knee extension. I'm going to start with the good leg. I'm going to hold actually underneath here so I don't put my supporting hand on top of the quads and potentially shut them down. And have you hold there and resist with about 10 to 20% of your strength. And relax. Any pain? Okay. Let's try this side. So hold there and resist. Relax. Any pain?
Super mild, but it's just like I'd say it's on like the medial side.
Okay. So as she's engaging more of the vastus medialis muscle, we're getting a little bit of pain, and it looked like her body was compensating just a little bit more. So maybe a little bit of weakness on these quads in general, maybe more on the medial side, right? So go figure, she could have a couple things going on, right? She could have a little patellofemoral pain syndrome and a little bit of a medial collateral ligament sprain of some sort, or maybe a little tear, we don't know. Okay. All right, hamstrings. Let's have you on your belly. Test the right leg first. We want to test the hamstrings as a group and not really differentiate between the medial and lateral hamstrings. We're just going to flex her knee slightly. Going to ask you to hold your leg there. Usually try and put one hand somewhere else and resist. And relax. Feeling good?
I actually felt pain right through here.
Midline?
Mm-hmm.
Okay, we'll come back and we'll try and differentiate in just a second. just compare relative strength of both sets of hamstrings here. Go a little bit, hang on, a little bit less than 90 degrees of flexion at the knee is what I like. Hold there and resist. And relax. Any pain?
Nope.
Okay. You can see a little bit of the shaking there. So general weakness of the hamstrings and quads on the left leg, right? Now, is that the chicken or the egg? Did that create some instability in the knee and set the stage for that knee injury, or did the knee injury create instability in the quads and hams, or now trying to support it but not doing it effectively? Don't know. Okay. Let's see if we can isolate the pain in the hamstring. So if we want to isolate the biceps femoris, the lateral hamstring, still going to flex your knee, but then we're going to externally rotate the hip a little bit, and even just as Erin holds her leg up, you can see the tendon of the biceps femoris pop out. So that's going to accentuate the activation of the lateral hamstring rather than the medial hamstring. So I'm going to do the exact same action. I'm just going to try and extend her knee as she resists.
Oh, yep, there it is.
Pain?
Yeah.
Okay. Up top?
Mm-hmm.
Okay. Near the ischial tuberosity?
Yeah, that's what it was.
Okay. Let's see if we get any pain on the when we kind of isolate the medial hamstring. So then we're just going to internally rotate. Now you can see semitendinosis, so we're again just kind of highlighting the medial hamstrings. Again, I'm just going to extend, resist.
Yeah, I feel it there too.
Okay. So where do all three of the hamstrings attach approximately? Yeah. Ischial tuberosity. So go ahead and let that relax. So not a specific medial or lateral hamstring issue, but just the hamstrings in general. So if we palpate that ischial tuberosity, see if there's any pain there specifically. Any tenderness? So you're a little bit lower down.
Yeah, it felt like it was like right in there, if that makes any sense.
And it stands out a little bit right there. So, if anything, I'm going to go a little bit more of the medial hamstrings is having some tightness than the lateral hamstring. But again, they all share that attachment on the ischial tuberosity. So we got, interestingly, a little bit of hamstring issue on the right side. However, if she's got an injury to the left knee, she's going to spend more time on that right leg. So they're going to be tighter, right? All right. Questions on the hamstring test? Particular differentiating medial lateral, going once, going twice. Sold. Okay. Medial knee pain, maybe an MCL issue, could be a Pezan-Serine issue. So we've got 3 muscles to test for. Oh, so could you write the Sargent muscles up there for us again? So let's test sartorius and see if that's creating some of this medial knee pain. So sartorius again is the, and I'm going to change it because S goes with S, the seamstress muscle.
No, come on. It literally means Taylor, so let's stick with that.
Stop. Just when I decided to change it, right?
You're trying to be politically correct.
All right. It doesn't matter anymore. All right. So, can I say that? All right. So, it does hip flexion, abduction, external rotation of the hip, and knee flexion. Right? So those are essentially all the actions of sartorius. So we're going to have Erin hold her leg there. And I'm just going to try and straighten her leg back down to the table. So I'm going to do all the exact opposites. Okay, relax. So no pain. I could test it for weakness comparative to the right leg, but what we're really looking for is pain. Okay. So we've ruled out sartorius as being the cause of that medial knee pain. Gracilis is going to be an adductor. So what I don't want to do is put my hand right over the gracilis, because again that might inhibit its ability to contract. I'm going to put it just distal to the knee. I'm going to have you hold your leg there, and I'm going to try and push you out.
Maybe a little bit, yeah, like up here, if that makes sense.
Okay. Yeah.
And not anything intense.
Okay, but not at the knee?
Not at the knee.
Okay. So again, useful information, maybe a little bit of something going on with the gracilis proximally, but not tied in directly with the medial knee pain. And then we tested her hamstrings, and there was no knee pain on the hamstring test?
Mm-mm.
Let's do it again. Here's how we can do it. Flex your knee a little bit, and then pull your heel down into my hand. Just generically testing hamstring.
Actually, yeah.
Yeah?
There is.
Okay, relax. Where's
Like,
that pain?
Up there.
Yeah, it doesn't count.
Not on the knee. No.
Not on the knee, right? So again, useful information, but it doesn't help us hone in on what's going on with the knee. So no pain on sartorius, gracilis, or semitendinosus muscle tests, which probably says MCL. Right? And I did get a little tenderness on the palpation of her MCL. Questions before the last couple?
Which one? You said, which was it, the meniscus that gets really inflamed, or the bursitis that makes you really inflamed? Like that you would swell up?
Bursitis.
Bursitis, okay.
Yeah. Okay. Let's check for patellofemoral pain syndrome. Okay. Patellar mobility. So we're going to put both legs down. Some people talk about putting a bolster or a roll underneath the knees when you're testing the mobility of the patellas. I think it's kind of up to you. So we're going to start with the unaffected side. So we're just going to kind of compare the amount of motion that her patellas have medially and laterally. That looks pretty good. Typically what will happen is if the patella keeps getting pulled laterally, when you try and push it medially, it's not going to go. Right? Doesn't usually recreate pain, but... And if anything, I'd say she's got too much motion medially.
Yeah, that one kind of goes all over the place. The left one.
Yeah. So we've got a little bit of instability with how the patella is moving. Alright? And we had a little bit of weakness in the quads. So maybe if we strengthen the quads, that'll keep the patella more centrally located, and maybe that is really the cause of her medial knee pain. I still think it's probably a little bit of an MCL issue there, though. Clark sign. So I'm going to put the yoke of my hand just above the patella and bring your leg out just a little bit. Okay, so it's important that we don't put pressure directly over the patella. So just above it, and then I'm going to apply pressure kind of towards Erin's feet. Okay, is that right?
Mm-hmm.
And then I'm going to have you actively engage your quads. So just extend your knee a little bit. There. And relax. And contract. And relax. Any pain?
Mm-mm.
Okay. So what that does is it creates a little bit of extra stretch or compression on the patella. If the pain is coming from malalignment of the patella, that should fire it up. So we got a negative result on Clark sign, but we do know that her patella's got a little bit too much motion. So would I say she has patellofemoral pain syndrome? Maybe a little bit. Alright, but it's not clear cut. This is the fun part. It's like, what? It doesn't mean, we haven't figured out anything, right?
What makes it positive?
The fact that she's got like hypermobility in the patella, right? But no pain associated with it. So we're kind of like on the cusp again, right? Maybe she's got like, could there be a pre-patellar mobility, pre-patellofemoral pain syndrome, right? It's like it's just like PP.
If she
PP.
had pain, then she definitely would be positive.
Yeah. She's like maybe pre-symptomatic. Okay. All right, let's check this meniscus. Put one over. So of the tests, this one's probably the most confusing. So first thing we're going to do is we're going to flex her knee and we're going to compress the tibia into the femur. So we're going to create compression on the menisci, and then we're going to twist. So we're going to recreate the typical mechanism of injury, compression with rotation. So if we do that and it creates pain, there's a high likelihood that the meniscus is injured. But it could be something else I'll talk about in a second. The important part with this is that as I push, or as I rotate her leg, I want that rotation to be with the tibia and not just in the foot and ankle complex. Okay? So you can either hold here and as you compress with the other hand perform the rotation, or you can just hold the leg this way, compress and rotate, whatever works for you. Okay? So I'm going to sandwich the tibia, I'm going to compress it straight down. So we're loading the meniscus. Any pain?
Mm-hmm.
Yeah.
Mild though.
Okay. How about this way?
No.
Okay. So, possible meniscus, because we have pain with the compression and rotation. What else gets stressed while we're rotating the knee?
Like the other ligaments or the interosseous membrane?
The ligaments, in particular the MCL and the AC. Well, you can argue all of them, but really the MCL and the ACL are getting stretched as well. So is that pain with compression and rotation from the meniscus, or is it just stretch of the ligaments?
You said ACL?
Yeah, it could be ACL, right? So it depends.
That's what you said.
Can you identify where the pain was?
It would be medial.
Okay. So then that suggests more of a medial collateral ligament issue, but again, possible meniscus. Then we're going to do the distraction. So I'm going to separate the two. So I'm taking pressure off of the meniscus and then rotate. Any pain?
Mm-mm.
Any pain?
Mm-mm.
So I've unloaded the meniscus. Now we're focusing on ligament, right? There's no pain now, so that means it's probably not a ligament issue. All right? Try it one more time. Any pain? Any pain?
No.
So there's pain on the distraction
Yeah,
test
that's a
that would more
question.
suggest a ligament. If there's pain only on the compression, then that's
More
more.
likely meniscus. Yeah, does everybody get that? So pain only on distraction more likely indicates ligament. Pain only on compression more likely meniscus. Okay, you're confusing.
I know.
Right?
I've had so many MRIs, and the only thing they've ever been able to tell me is that my patella tilts more than it should.
Yeah.
So it doesn't sit in the groove.
Yeah.
But that's it.
Okay.
It's literally everything.
Okay. So we'll rule out her, well, based on our test, possible meniscus. Pain was on the medial side. No pain on the distraction test, so that kind of rules out the ligaments. But she did test positive on the valgus test, so I'd say she's probably got a little bit of an MCL issue and a little bit of a medial meniscus issue, right? So 2 out of the 3 components of the unhappy triad, but not so clear, so obvious that we can go, oh, that's exactly your issue. And that kind of goes along with the imaging that not a whole lot definitive has come up. Okay. Questions, thoughts? We got one more to do. All right. The over test. Let's have you turn lie on your left side. We're going to test your good leg on this one. Okay. So we're testing the length of the TFL, or the ITB by way of the TFL. Okay. So what we're going to do is we're essentially going to bring her leg into a little bit of abduction, and we're going to let it drop towards the table, okay, to see how well this elongates. So we're going to go ahead and bring this leg up just a little bit. Perfect. And we're going to bend this knee. I'm going to support under the knee and kind of sandwich the lower leg or ankle and foot between my elbow and my rib cage. And then I'm going to bring her leg back so that it's in line with her torso. So we're trying to recreate essentially standing position. All right. I'm going to raise her leg up, and then I'm going to try and let my hand slide down towards her ankle, and we're going to watch to see how well her leg drops. Okay. Obviously, if someone has medial knee pain, which she does on that leg, probably don't want to do this test. So I'm doing it on her right leg. Okay. So on 3, we're going to drop your leg. Okay. So first, try and give me the weight of your leg. There we go. All right. 1, 2. Never go on 3 because they always anticipate it. Okay. So if the leg stays parallel to the floor, middle of the road in terms of length. Okay. What you'll read is that ideal length is the knee going all the way to the table without internally rotating. I think that's a little excessive. Okay. So I believe that the thigh being somewhere halfway between parallel to the table and on the table would be ideal. Okay. If it stays above parallel, or if it doesn't drop at all, there's a lot of tightness in here. So let's do it. I usually do it 2 or 3 times. Again, nice and heavy. The other trick to watch is, especially if you're taller and your patient is shorter, is that when you let the knee drop and you slide your hand down to the ankle, you don't end up with a lot of internal rotation, okay? So that might mean that you need to get a little bit down lower in your legs if you're a taller practitioner, okay? So nice and heavy on 3, 1, better length. That looks pretty good. Halfway between parallel and to the table, okay? Does that feel all right?
Mm-hmm.
Okay, one more time. Oh, let it go. There. So that's about ideal, right? But again, if someone had really tight TFL or IT band, we would do the over test and we get something like that, right? All right. Questions, thoughts, a lot of stuff.
But because of the fact that she's experiencing medial knee pain, you wouldn't do the over test with them?
I wouldn't do it. I wouldn't do it on her left side.
Okay.
Nope. Got too much laxity in multiple directions. Got some laxity in the ACL, not causing pain per se, but there's a good bit of movement there.
Mm-hmm.
Some MCL with the valgus stress test and with the direct palpation.
Mm-hmm.
Questionable compression distraction test. Nah. That's when I'd say, go get some imaging or go see somebody, and she's already done that. Right? So, but she's also not indicating she's got symptoms of IT band pain. Right?